Hello, people. Hope you're all doing good and safe. I know we are reaching into the peak status of our pandemic, and I think today's topic is very relevant in this scenario. I would like to speak about one of the common psychiatric disorders. Before that, I would like to give you the World Health Organization's definition on what is a mental health disorder. According to WHO, mental health disorders comprise a broad range of problems with different symptoms. However, they are generally characterized by some combination of abnormal thoughts, emotions, behavior, and relationship with others. Some of the types of mental health disorders are anxiety disorders, which include panic disorder, OCD, obsessive compulsive disorder, and phobias. Depression, bipolar, and other mood disorders, personality disorder, post-traumatic stress disorder, psychotic disorders. These all come under disorders. And now let's get back to our today's topic, anxiety disorder. So what is anxiety? It's our body's natural response to stress. It's a feeling of fear or apprehension about what to come, or it is a worry that is strong enough to interfere with one's own daily activities. So what are anxiety disorders? Anxiety is a normal emotion. It's your brain's way of reacting to stress and alerting you of potential danger ahead. Everyone feels anxious now and then. For example, you may worry when faced with a problem at work, before taking a test, or before making an important decision in your life. Occasional anxiety is okay, but anxiety disorders are different. They are a group of mental illnesses that cause constant and overwhelming anxiety and fear. The excessive anxiety can make you avoid work, school, family get-togethers, and other social situations that might trigger or worsen your symptoms. There are several types of anxiety disorders. Among them, the first is generalized anxiety disorder. You feel excessive, unrealistic worry and tension with little or no reason. Another one is a panic disorder. You feel sudden, intense fear that brings on panic attack. During a panic attack, you may break out in sweat, have chest pain, and have pounding heartbeat. Sometimes you may feel like you are choking or having a heart attack. Another one is a social anxiety disorder, also called social phobia. And this is when you feel overwhelming worry and self-consciousness about everyday social situations. You obsessively worry about others judging you or being embarrassed or ridiculed. For example, you feel intense fear of a specific object or situation, such as heights or flying. The fear goes beyond what is appropriate and may cause you to avoid ordinary situations. The next one is agoraphobia. You have an intense fear of being in a place where it seems hard to escape and get help if an emergency occurs. For example, you may get panic or feel anxious when you are in an aeroplane, public transportation, or standing in a line with a queue. Another one is separation anxiety. Little kids aren't the only ones who feel scared or anxious when a loved one leaves. Anyone can get separation anxiety disorder. If you do, you will feel very anxious or fearful when a person you are close with leaves your side. You'll always worry that something might happen to your loved ones. And finally, the selective mutism. This is a type of social anxiety in which young kids who talk normally with their family doesn't speak in public area or schools. Medication-induced anxiety. The use of medicines or the legal drugs or the withdrawal drugs can trigger some symptoms of anxiety disorder. So, what are the symptoms of anxiety disorder? The main symptom of anxiety disorder is excessive fear or worry. Anxiety disorders can also make it hard to breathe, sleep, stay still, and concentrate. Your specific symptoms depend on the type of anxiety disorder you have. The common symptoms are panic, fear, and uneasiness, feeling that he or she is in danger, the sleep problems, not being able to stay calm and still, cold, sweaty, numb, or tingling hand or feet, shortness of breath, breathing faster or more quickly than normal, heart palpitation, dry mouth, nausea, dizziness, thinking about a problem over and over again and unable to stop, inability to concentrate, or obsessively avoiding feared objects or places. So what are the causes of anxiety? Researchers doesn't know exactly what brings an anxiety disorder. With a lot of studies, they have come to some points. One is genetics. Anxiety disorders can run in families. Next is the brain chemistry. Some research suggests that anxiety disorders may be linked to faulty circuits in the brain that control fear and emotions. Another one is environmental stress. This refers to the stressful events you have seen or lived through. Life events often linked to anxiety disorders include childhood abuse and neglect, a death of a loved one, or being attacked or seeing violence. Hence, another reason for anxiety disorder is the drug withdrawal or the misuse. Certain drugs may be used to hide or decrease certain anxiety symptoms. Anxiety disorder often goes hand in hand with alcohol and substance use. And some medical conditions, some heart, lung, thyroid conditions can cause symptoms similar to anxiety disorder or make anxiety symptoms worse. It's important to get a full physical examination to rule out other medical conditions when talking to a doctor about anxiety. Risk factors. So, what are the risk factors of anxiety disorder? Some things also make you more likely to develop an anxiety disorder. They are called the risk factors. Some risk factors you can't change, but others you can. It includes a history of mental health disorder. Having another mental health disorder, like depression, raises your risk for anxiety disorder. Childhood sexual abuse, emotional, physical, and sexual abuse or neglect during childhood is linked to anxiety disorders in later life. Another one is trauma. Living through a traumatic event increases the risk of post-traumatic stress disorder, which can cause panic attacks. Stressful or negative life events like losing a parent in an early childhood increase your risk for anxiety disorder. Severe illness or chronic health condition, constant worry about health or the health of a loved one or caring for someone who is sick can cause you to feel overwhelmed and anxious. The use of alcohol and illegal drugs makes you more likely to get an anxiety disorder. Some people also use these substances to hide or ease anxiety, symptoms which end up in other traumas. Being shy as a child, shyness and withdrawal from unfamiliar people and places during childhood is linked to social anxiety in teens and adults. Negative perceptions about yourself may lead to social anxiety disorder, that is, low self-esteem. So, how are we going to diagnose social anxiety disorder? A mental health professional or a counselor or a psychologist or a psychiatrist can help you to diagnose the situation. They will ask you questions and use tools and testing to find out if you may have anxiety disorder. The doctors will consider how long you have had the symptoms and how intense they are when diagnosing you. It's important to let your doctors or counselors know if your anxiety makes it hard to enjoy or complete everyday tasks at home. Well, anxiety disorder treatments. There are many treatments to reduce and manage symptoms of anxiety disorder. Usually people with anxiety disorder take medicine and go for counseling. I'll wind up this video by mentioning some of the tips that can be followed from our side to reduce or lessen the anxiety symptoms. First thing, learn about your disorder. The more you know, the better prepared you will be to manage symptoms and roadblocks along the way. Don't be afraid to ask your doctor any questions you might have. Suddenly stopping your medicines can cause unpleasant side effects and can even trigger anxiety symptoms. Try to cut down the foods and the drinks that have caffeine, such as coffee, tea, cola, energy drinks, and chocolate. Caffeine is a mood-altering drug and it may make symptoms of anxiety disorders worse. Please don't use alcohol when you are anxious. Substance abuse increases the risk of anxiety disorders. Eat right and exercise. Brisk aerobic exercise like jogging and biking helps release brain chemicals that cut stress and improve your mood. Get better sleep. Sleep problems and anxiety disorder often go in hand. Getting good rest is a priority. Follow a relaxing bedtime routine. Talk to your doctor if you still have trouble in sleeping. Stress management is an important part of your anxiety disorder treatment plan. Things like meditation can help you unwind after a stressful day, and it may make your treatment work better. Try to keep a journal. Writing down your thoughts before the day is down may help you relax so you are not tossing and turning with anxious thoughts all the night. Manage your negative thoughts. Thinking positive thoughts instead of worrisome ones can help to reduce anxiety. This can be challenging. Get-togethers with friends, whether it's in person or in phone or in the computer, social connections help people thrive and stay healthy. People who have a close group of friends that support and chat with them have lower level of social anxiety. And some people find it helpful and uplifting to talk to others who are experiencing the same symptoms and emotions. Self-help or support groups let you share your concerns and achievements with others who are or who have been there. It can be challenging and frustrating to live with an anxiety disorder. The constant worry and the fear can make you feel tired and scared. If you have talked to a doctor about your symptoms, then you have taken the first step towards letting go of your worry. It can take some time to find the right treatment that works for you. If you have more than one anxiety disorder, you may need several kinds of treatments. For most people with anxiety disorders, a combination of medicines and counseling is the best. With proper care and treatment, you can learn how to manage your symptoms and thrive. Today is 10th October and we celebrate this day as World Mental Health Day. Stay safe. Bye-bye.